their November meeting. So again, really excited to see that process moving forward. I'm going to move down to item G1 and 2. Item G is a resolution accepting $154,000 in grant funds for the High Intensity Drug Trafficking Areas Program. And just to be clear, that's a program that's intended to reduce drug trafficking in areas where drug-related activities are having a significant harmful impact. APD acts as the fiduciary for that grant, and the grant's focus is only on cases that deal with trafficking, manufacturing, or the distribution of illegal drugs, not simple possession cases. Councilwoman Roney.
Yeah, thank you. This is just a procedural question, and I'm hearing this from the public. I think it's probably a good idea. And so I'm going to try to make this request and be consistent with it, is that when I have a concern about a consent agenda item where there's going to need to be like questions for the staff, or that I'm anticipating there might be public engagement around it, that I might go ahead and ask at our agenda briefings to pull it off so we could put it either in old business or new business for review. In this situation, I would be asking for a separate vote. So I just think that it's my responsibility when those questions are coming up for me about our budget priorities and the kinds of ways that we spend our resources to implement budget plans and policies. This is a situation where I would suggest that this come off the consent agenda and be considered under old or new business.
Kim, I'd just like to ask a question. Your concerns, you said that the concerns of the community as well as your concerns, maybe you can just give me a little more background as why you would be concerned about monies being put in our community to help high traffic to prevent, the expansion of drug use.
Well, if it was really truly about prevention, then we would probably be working with community health workers, peer support specialists, doing a relational response that would prevent this kind of activity in the first place. But from what my studies have shown and best practices for preventing drug crimes in the first place, this is reactive after the fact and historically targets BIPOC, Black and Indigenous person of color communities. But also it's a matter of budget priorities, and I would love to be doing some crime prevention work instead of crime response work, especially when the outcomes usually result in, for example, more traffic stops. So those are the kinds of like consistent questions I've had about the HIDITA over the past 4 years. So the conversation isn't new, but by just flowing through the consent agenda, we don't end up having those kinds of deeper conversations. And what I'm hearing is that when I've been waiting just to pull it off of the consent agenda in the meeting, it's unfair to staff that may be able to provide more of a presentation on the why, but also it makes it so that the public doesn't have as much opportunity to engage as to say if we were to have that conversation in old or new business.
Okay, now only thing I want to say is, I think that in light of the large scale of the things that we have to deal with the drug issue, I think we need to have all kinds of ways. I think there's a need for all kinds of activities to work together to prevent it. I don't think there's one or the other or either or. I think there must be a big spectrum of ways to attack it. And I look at this as only one way that's attacking it. And your way is also another way, but I don't think it should have anything to do with funding that's provided to actually, forward their agenda. So,
and I think this is an excellent example of the kind of conversation that we could be having in the public sphere if we were planning ahead for these kinds of conversations to be had at the council level at a deeper level as far as like strategy and planning. But it doesn't really happen in the consent agenda. And I'm just trying to think about a better way that I could ask for this kind of item, not to just be pulled off and be a yes, no vote on a consent agenda item, so that we can hear exactly what you're suggesting as far as that sort of like ecosystem of response.
Deborah, did you want to say something? Because I'd like to speak to the process piece of it.
Sure. I would like to say that this went through committee. Environmental Safety Committee had a discussion on this and other grants. So it has had some discussion about the role, also that this is a collaborative effort. This isn't just the city of Asheville. There are state, federal, and it's multi-jurisdictional in scope. And again, our role is a fiduciary. We're pass-through and ensure that funding and needs that are identified, that they are appropriately compensated in terms of those jurisdictions for their work. Mayor, I'll turn it over to you.
Yeah, I think that's a very important part. The consent agenda has things that are just, we're only a fiduciary in this. We're just accepting money. We do this all the time. And, I don't mean disrespect Councilwoman Roney, but if we pulled every single item off the consent agenda that you wanted to vote no on and had to deal with them separately when it's going to be a 6-1 vote, it would require us to put them on other places on the agenda, take public comment, and it would make the process very burdensome. So I don't think it's fair to the rest of council to indulge one council member who wants to vote no on anything and everything that has to do with the police department, just so that you have that opportunity when this is really a routine matter. So I'm not inclined to pull it off the consent agenda.
I appreciate that that's the decision of the city manager and the mayor's position. I'm offering this as an opportunity for us to have deeper conversations and look forward to other ways that we might continue to do that.
Okay, moving on, I'm going to cover item I next, and we've done this a few months or several